This training is being conducted by the Department or Directorate of Cancer Prevention and Control. Among cancers, there are cancers that are preventable, and there are those that they can only be minimized, but they don't have specific control measure because they don't have specific cause. So this bladder cancer is one of the cancers. The one identified here as squamous cell carcinoma of the bladder is one that is identified to be preventable because it has an identified cause, and that identified cause is what we call schistosomiasis, otherwise called bilharzia, or tsarkiya in Hausa, or Fitsarin Jini in Hausa. The Honorable Commissioner, Ministry of Health, Kansa State, Dr. Aisha and Anka, every represented by the Director of Public Health, Dr. Yusuf Abubakar Haske, the Executive Secretary, Zamfara State Hospital Service Management Board, Alhaji Mustafa Maraba, Scientist Mustafa Maraba, the Executive Secretary, Zamfara State Primary Health Care Development Board, Dr. Hussein Yakubu Anka, the Director, Cancer Prevention and Control, NICRAT, Dr. Usman Waziri, every represented by Dr. Aminu Mohammed Nabuche, Medical Director, Ahmad Sani Ali Mbakura Specialist Hospital, Dr. Bashir Isa, the Chairman Medical Advisory Committee, Ahmed Sani Ariman Bakura Specialist Hospital Gusau, the other team members, Nikrat, Nas, Mustafa Saminu, the media people here present, I'm greeting you with the best of greetings. May peace and blessing of Allah be on all of you. Assalamu alaikum wa rahmatullahi ta'ala wa barakatuh. NICRAT, as the name implies, National Institute for Cancer Research and Treatment, is a national body scheduled with responsibilities of research on cancer and cancer treatment. And the Department of Cancer Prevention and Control is one of the departments, is one of the directorates under the NICRAT. Today we are here to declare open the capacity building workshop for health workers in Zamfara State on schistosomiasis and bladder cancer. Bladder cancer is one of the preventable cancers, but unfortunately is still ravaging many of our communities. And the primary culprit is schistosomiasis, which is a treatable disease and can be prevented. Nigeria is the country that contributes the highest burden of schistosomiasis in the world among 78 countries that are still having transmission. Ogun and Lagos states are the states with highest prevalence of schistosomiasis. However, at the regional level, the Northwest region is the region with the highest burden. And 3 states out of the 7 states in the Northwest region are having moderate to high transmission. And these states are Sokoto, Kebbi, and Zamfara. And that's the need for this. That's why this workshop is organized in the state to sensitize the health workers at the primary level of care and secondary level of care who are in contact directly with the grassroots. If we can prevent schistosomiasis, we can also prevent bladder cancer. We know bladder cancer treatment in Nigeria is a big challenge because most of the time our patients present at advanced level of the disease, and that's making it difficult for its management and treatment, and it is very expensive. I know many specialists that can treat this bladder cancer, so it's better prevented. So this program supposed to be from 23rd to 27th of this month, and during this program the participants are going to be having several lectures and interactive sessions, and even a real patient case scenario that will boost their understanding of schistosomiasis and will also boost their understanding of managing schistosomiasis, and will also give them information and rightful information on how to refer cases of suspected bladder cancer. With this, we hope after the training, these health workers will go back to their various local governments and implement what they are taught. The participants are drawn from all the local governments in Zamfara state. Each local government has 2 participants, one from primary health care and another one from the secondary health care. And 2 other participants are added to 2 other hospitals within the state capital. And our hope is that after this training, these people will go with rightful information and they will manage these cases appropriately and also refer them early when they suspect bladder cancer. With this, I would like to say thank you all our invited guests, and thank the ministry, the hospital management board, the primary health care board in Zamfara state for supporting us by giving us permission to have these wonderful participants to be with us for these brainstorming interactions. We thank you and we look forward to have more support and more cooperation when next we are having something like this. And the interaction will continue. We are going to have direct visit to the facilities and also have a WhatsApp group where we will continue to interact. And thank you all for the support. Wa alaikum salam wa rahmatullahi.
Who is the main service provider in terms of cancer. Another very important service provider that is taking the whole healthcare personnel in the states. The only ES we have who has all the facilities in the states. All the money that is going to him. The ES of primary healthcare. Yes. 500 and something facilities is not a joke. Thank you very much, sir, for having time to come. Our very able partner, the WHO, is also coordinating all the partners in the states. The team lead of this program, my brother, Dr. Ibrahim, another very important resource person in this regard, the MD of the Bokun Specialist Hospital, very senior colleague, Dr. Bashir Gusau, the CIW0N. My senior colleague here invited our very key staff from the primary care facilities, We only have one lady here, so I think we are a little bit gender sensitive, not gender wise. Lady and gentlemen of the press, Assalamu alaikum. It's a very great honor for me here to represent our able honorable commissioner, the person of Dr. Aisha Anka, who is unavoidably absent due to certain official engagements. She asked me to be here to represent her for this very important occasion. Firstly, all that she asked me to say, I think the team lead, my brother Dr. Ibrahim has said that. And the second part of what she asked me to say, I think the WHO coordinator was able to also say that. So many things that she asked me to say, I think a lot of high dignitaries has mentioned that the only thing that is remaining that I will say is that as we are being trained here, we are now the cancer focal persons of our local government as well as facilities. This is just one part of the State Ministry of Health Cancer Initiative Program that Dr. Gusau is going to champion in the next few days to come. Now, we are going to give you a very standard documented data in terms of cancer management in Zamfara State, I'm sure of that. And the Ministry of Health will key in to that National Health Sector Reform Agenda of the Honorable Minister of Health in terms of cancer. As we prioritize cancer treatment in Nigeria, Zamfara State will key into that initiative. We have started discussing together with team lead and other stakeholders here. We have an oncologist in the states, and we have also a pathologist in the states. The cancer focal person is a radiologist. So we have the two complements to strike action and begin to operationalize the cancer intervention initiative in the first states. That is one. When this program, or even before this invitation came in, I was in Abuja with my also brother, Dr. Professor Malemi. I met him myself, and the Ministry of Health paid him a courtesy visit with this regard. And he told us that he is going to support Zamfara State Ministry of Health and build the capacity of healthcare providers. And today we are witnessing that. He followed up with a letter to the Ministry of Health, and that letter was submitted to me as the Director of Public Health, and I quickly escalate to our able state executive secretaries here, and I informed them that this is what we are going to do. And with their support and commitments and collaboration support, they selected you to participate in this very important event. And I gave that feedback to the two coordinators here, my brother Dr. Ibrahim, as well as my other brother also, Dr. Nahuji. We send them your names, and with the support of God Almighty Allah, you people are here. That's not just it is. It means as we are going to be trained, it is required for you to also train other people at the LGE level and also at your facility level. Dr. Hussein has mentioned that at this stage now, we are to be very rigorous in terms of prevention aspect of the management of cancer, which is very key. And he also mentioned that, I think it's the ES Fitsarin that mentioned that bladder cancer is preventable. I think even the team mentioned that. So you can see if the knowledge we are going to have here, we are going to put it into practice. I think we will do a lot. So the Honorable Commissioner asked me to inform the team lead that please a take-home for you to the Professor Malami. Please tell him that the Ministry of Health is grateful for this kind of gesture, and we look forward. We look forward to further collaboration. We also have other cancers. We have pediatric cancers. We have that of female cancers, breast cancer, cervical cancers. All these cancers require support from the office of Professor Malami, and today is the beginning of getting those support, which your own kind of action that you are going to take from your respective facilities after this very important engagement. Having said that, we are training 28 local government cancer champions now. And as I mentioned, the Ministry of Health looks forward for further collaboration with you in terms of getting more information, more patients, more data, so that we can continue to engage other partners and the National Cancer Research Institute for further support. With this few information, I think it is time for us to declare this workshop of so by the power and the authority vested in me, I declare this workshop open. Thank you very much. Because hospital service will involve the movement for consultants and family, all other MDs of general hospitals in the states, invited guests, my staff from primary health care agency on various local governments. Ladies and gentlemen, good morning to all. I'm delighted to stand before you here for this very important occasion. Of course, as rightly what my event said, Dr. Hamid has already summarized all the activities. We don't even know what to say. We just to call the attention of the participants. More importantly, you know, cancer is more of prevention. For this program, we are more of prevention than prevention. Why? Because at this level, we cannot treat cancer. It's more of preventive measures. So prevention mostly is more at the primary level. And the incidence of this bladder cancer, based on what we are discussing today, is more specific to blood clot parasites, which is cystosomes, Monsonia rheumatica, and the rest. Now, we have 726 primary health care facilities across the state in 147 wards across the 30 local governments. In each, we have staff that are managing those facilities. And we don't even have accurate or standard laboratories for diagnosis at primary health care level. Now, I'm calling the attention of my staff from the various local governments to pay attention to this, because for now, your number is insignificant to be the ones to lead this activity, but rather, immediately after, you need to go and escape to the other facilities. That is where the diagnosis will start. With this short talk and my remarks, I welcome each and everyone else here and wish us a successful celebration. Wassalamu alaikum.
Please permit me to stand on the existing protocol.
I want to congratulate Zamfara State for this laudable activity. And for WHO, it is more of the continued commitment from His Excellency, the President Governor of Zamfara State. When he declared the state of emergency in health, we've seen the infrastructure being improved. We've seen equipment being given for health workers to deliver. And we are also aware of the planned recruitment of health workers. The next thing is to build the capacity of the health worker to fully deliver. And this is one of the reasons why Zamfara State has been in recent times the leading state in terms of health interventions. And for the participants, I want to echo what the ES said. It's very key for us to generate qualitative data. I was just discussing if we have a cancer registry in the state, because in terms of interventions, the federal government has committed cancer prevention treatment as one of the key priority areas in terms of health intervention. And Zamfara State have to key in. Key in have to come with documented evidence for us to be able to access all those resources that are coming into the cancer space. And it has to start with data that are being generated for us to be able to showcase that in Zamfara State, this is the prevalence of this and this and this data. And for the bladder cancer that we are building our capacity today, let us start with this. With these few remarks, I want to continue to pledge the continued support of WHO in ensuring that we support the state government in improving the health indices and the population of Zamfara State at large. Thank you very much.
Unity, coordination, and cancer management in the Zamfara community. So it will not only be capacity building for managing the cases. I want to advise that data is very important. And I think part of what is supposed to be discussed is maybe how to be generating and harmonizing our data at the state level. I know we have some other, I don't know whether we have some colleagues now in the state. I think it was the paper and the Wato school. So importantly, I think the participants, honestly, we need to listen very attentively. And I'm very happy with the representations. All the primary health center facilities are here, secondary facilities are here, and some other health workers also. And I also learned that this is sort of TOT training. So it's going to be cascaded down to the ground level. I want to assure you that the State Ministry of Health and the state government are doing enough. Within the last 1 year, some of you, especially those that are on our services, they can testify they have not attended anything less than 5-6 programs under the state. It didn't just come by that, honestly speaking. It has to do with the commitment of the state government on issues of training. For me and for every other person, training is key, especially for educators. So it can never be too much. And I'm happy to say that the Ministry of Health and all the affected, we are always ready, honestly, to collaborate with any agency that is willing to give training and capacity building to our educators. Because that means more science will be contributed to that. So I want to say that the truly determined, you have said everything. In fact, we are discussing that you have said everything, you didn't need anything for us. So I wish all of us to make fruitful deliberations. Thank you very much.
Chairman of Education, please permit me to stand on the already established existing protocols. First of all, I would like to say that actually at the state level, last year, since the inception of this government, I was actually assigned as the Kansa focus person for Zamfara State, and this is because the state want to establish a unit where there will be standard data on all cancer cases, because there has never been well documented data on that, and that is under the office of the Director of Public Health. And though he was away when this program came up, he actually intimated me and asked me to be part of the program, and henceforth any cancer issue or program, the state is willing to support any partner that is willing to collaborate with the state for issues on cancer, and that they are going to generate data. And inshallah, we are going to use you people as from the primary and secondary healthcare as well as those in tertiary, so that we have a team where all the cases are documented, and if required, we have a standard and well documented data, and the state can now boast with the data that is available. And anywhere there is any issue on cancer, inshallah, we'll be able to present evidence-based data, and with that, the state will receive all the support is needed, inshallah. So with that, I would like each and every one of us to please remember that you are here because you are selected, and you are going to be continuously engaged. And with the group that is created, believe you me, we are going to disturb you on ensuring that, one, you meet up with your responsibilities, and we are not going to joke with documentation. So we should please ensure that all cases are documented and reported as well. As you have that there is actually interventions that the federal government is even willing to provide. And with such, once you don't have data, you are not likely to receive those interventions. With this, I'm saying that we thank the NICRAT and the organizers for our program, and we wish them well, and we wish that more programs will come up. As the WHO representative and the chairman of football said, that this is one of the, this should sound like a starting point, and inshallah we are going to try our best to ensure that we actually deliver, and the data will be one of our backbone, so that we can present data anywhere in the world. Thank you so much, and congratulations.
اللهم أنت أول ليس قبلك شيء، وأنت آخر ليس بعدك شيء، وأنت باطن ليس دونك شيء، وأنت ظاهر ليس فوقك شيء. اللهم إنا نسألك بأسمائك الحسنى وصفاتك العلى، ونشهد أنك أنت الله أحد الصمد الذي لم يلد ولم يولد ولم يكن له كفوا أحد. اللهم لا تدع لنا ذنبا إلا غفرته، ولا هما إلا فرجته، ولا دينا إلا قضيته، ولا مريضا إلا شفيته، ولا ضالا إلا هديته، ولا حاجة من هوائج الدنيا والآخرة لك إلا قضيت يا أرحم الراحمين. اللهم اجمع قلوبنا على الحق يا رب العالمين. اللهم بين الحق وارزقنا اتباعه، وجعل الباطل والعلم اجتنابه برحمتك يا ارحم الراحمين. سبحان ربك رب العزة عما يصفون، وسلام على المرسلين، والحمد لله رب العالمين.